Dr. William V. Williams, MD, is a rheumatology specialist in Philadelphia, Pennsylvania, with over 40 years of experience in the medical field and has worked for over 30 years in drug discovery and development. He is a graduate of Tufts University School of Medicine and practiced at the University of Pennsylvania. Dr. Williams is currently president and CEO of BriaCell Therapeutics Corporation.
Hi, this is Dr. Bill Williams again, talking about some of the less well-known effects of hormonal contraceptives. And one of those effects is bone fractures. Now, we know for a long time that estrogen tends to build up bone density and prevent fractures. And hormone replacement therapy for a long time was used for that purpose until it turned out that it actually increased some cardiovascular risk. And so that, has been discontinued. But on the other hand, when you antagonize estrogen, that decreases bone density, and progesterone has that effect. So it's been known for a long time, and it's acknowledged in the labeling of progesterone-only contraceptives that they decrease bone density. Bone density goes down, which you would expect would increase the risk of fractures, but that's never been acknowledged in the labeling. And in fact, in more recent studies, it's very clear that these progesterone-only contraceptives, which includes things like the implants, the shots, different progesterone-only formulations, these clearly increase the risk of fracture in women over time, especially with protracted use. 30 to 50% in some different studies increases in risk of bone fractures, which of course osteoporotic bone fractures are very common in elderly women. So protracted use of these progesterone-only agents clearly can contribute to that risk. Now, the normal pill is a combination of estrogen and progesterone, one of which you would expect to increase bone density and one would decrease it. And the early formulations of the pill had very high estrogen levels, but they had a lot of other side effects, and so they lowered those levels. And now the more recent data is also suggesting that these pills also may increase the risk of fracture and bone fracture in women. So this is something else to keep in mind when women are considering how they want to regulate their fertility. Again, natural family planning, fertility awareness-based methods have none of these side effects. So it's something to keep in mind. I'm Dr. Bill Williams. Thank you for listening.